Hello everyone, my name is Elizabeth and our title today is Understanding Depression in Mental Health. We'll be talking about challenges when it comes to depression. We'll be talking about the impact it has on people. We talk about the care and the approaches that we're going to take when it comes to depression. I will be doing the introduction as well as the conclusion. We've got Violet that will be doing the background of depression. I've got Olga that will be talking about the key issues of depression. I've got my colleague Audrea that will be talking about the critical analysis when it comes to depression. And she will also be doing the recommendation as well. We've got Vas that will talk about the practical implication when it comes to depression. And like I said, I'll be doing the conclusion. Introduction. According to the World Health Organization 2023, depression is a major public health concern and a leading cause of disability worldwide. It affects people of all ages and backgrounds, impacting people's thoughts, their behavior, mood, as well as their physical health. In the UK alone, the NHS identifies depression as a common mental disorder, with millions affected with it annually. Why it matters in health and social care. Depression can lead to poor quality of life, increased risk of self-harm and suicide, and long-term social exclusion. Health and social care professionals are often the first point of contact for affected individuals. I will now pass it on to Violet that will talk about the background of depression. Thank you very much.
Hello everyone, thank you Elizabeth for your introduction. Now I would like to talk about background of depression, particularly about some important factors that influence depression from history, society and culture. First, let's look at the historical part. Depression is not something new. It has existed for a very long time and has been documented for centuries, but was not talked about much. In the past, it was called melancholia by the Greek doctor Hippocrates. People believed it was caused by an imbalance in the body. Early 20th centuries, Sigmund Freud introduced the theory that depression stemmed from unresolved internal conflict, particularly from early childhood experiences. In the mid-20th century, scientists began focusing more on neurochemical imbalances, such as issue transmitters like serotonin and dopamine, which were thought to play a role in depression. Over time, the way we understand depression has changed. Today, we know it is a mental health condition. According World Health Organization, it is recognized as a major public health issue with an increasing prevalence worldwide, and we use science and medicine to explain it. Now, let's look at the social factors. When people go through a difficult life event like divorce, losing a loved one, or losing a job, these things can trigger depression. Also, if someone doesn't have support from family or friends, they might feel lonely or helpless. Social support and community are very important for mental health. Next, let's talk about culture. Depression can manifest differently across cultures. In some cultures, people are afraid to talk about depression. There is stigma, which means people might feel ashamed or think they will be judged if they ask for help. This can stop people from getting the support they need. Let's continue with more examples of how society and culture affect depression. One big change is industrialization and urbanization. This means that over time, people moved from countryside to big cities, and life became more stressful and busy. Many people feel pressure to work hard, and they don't have time to rest or talk to others. This lifestyle can lead to isolation and depression. Next, let's think about race, ethnicity, and money. People who live in poverty or have less access to health care are more at risk of depression. Also, if some ethnic minorities may face racism or discrimination, which can affect their mental health. So, depression is not only personal, but also connected to how society treats people. Additionally, cultural beliefs are very important. In some cultures, depression is seen as a weakness, not a real illness. People are told to be strong and not speak about their feelings. But in other cultures, it is more accepted to talk about and ask for help. So, the way people understand and express depression depends a lot of their culture. Lastly, let's talk about gender and depression. Women are generally at a higher risk for depression than men because both factors, biological, for example, hormonal changes, and social factor, for example, pressure-related gender roles, that affect more women than men. The World Health Organization reports that women are twice as likely as men to experience depression during their lifetime. So, understanding depression's background with its deep roots, biological, physiological, and social understanding helps us break the stigma and support those who struggle. Let's keep talking, keep learning, keep caring each other. Thank you. Now I pass to Olga to talk about key issues.
Hello everyone, today I'm going to talk about three key issues related to depression. The first is diagnosis and stigma, the second, access to services, the third, impact on careers and the health system. Let's start with the first, diagnosis and stigma. I would like to say that depression sometimes is not diagnosed correctly. This happens often in men, young people, and ethnic minorities. The symptoms may be missed or misunderstood, so people don't get the help they need. Stigma is also a big problem. Many people are afraid to ask for help. They feel ashamed or scared of being judged. They worry others will see them as weak. The media makes this worse. Depression is often shown in the wrong way on TV or online. This creates fear and confusion. People stay silent instead of speaking up. One study found that stigma stops people from asking for help. It also causes shame and isolation. Now I would like to describe the second key issues of depression, access to services. In the UK, many people wait a long time for therapy. The average wait for talking therapy is 4 to 6 months. This is too long for someone with depression. There is also a shortage of staff. Many mental health workers are tired and stressed. They have too many cases. This makes it hard to give good care. Another issue is the digital divide. A lot of mental health support is now online, but not everyone can use the internet. For example, older people or people with low income may not have access. Depression is a serious illness. Many people don't get help because of stigma and lack of services. Let's see how depression affects careers or the health system. First, depression can have a big impact on families and informal careers. There are usually people like parents, children, or parents who look after someone with depression. They often experience what we call career burden. This means they feel emotional stress, spend a lot of money, and don't always get the support they need. For example, some carriers might feel tired all the time or even become depressed themselves. Others might need to stop working to care for their loved one, which causes financial problems. Second, depression also happens together with other physical illnesses like diabetes or heart disease. This means that they need more help from the health and social care system. In conclusion, I would like to say that depression affects not only one person, but also their families, carers, and the whole health system. What we have to do is to reduce stigma, shorten waiting times, and offer more support to everyone involved. Thank you for listening.
Particularly worrying is the high increase in mental health between young population. Data from Office of National Statistics 2021 shows that rates of depression between young adults aged 16 to 29 have nearly doubled since 2019. This might be attributed to a range of factors, including the impact of COVID-19 pandemic, social media pressure, economic indecision, and general lack of access of timely mental health support. Hello everyone, Andrea here. Mental health has become an increasingly usual concern, both globally and within the UK. In the World Health Organization 2023 estimates that over 208 million people worldwide currently live with depression, highlighting in the scale the severity of the public health issue. In the British context, the situation is not less alarming. According to the National Health Services 2022, around 1 on the 6 adults report experiencing symptoms of a common mental health disorder. Within the past week alone, this indicates that mental health challenges are not only extensive, but also affect individuals on a regular basis.
Hi, my name is Wahin Sultani, and I'm one of the students of Health and Social Care with Foundation AIR. And today I'm gonna talk about practical implementation for health and social care workers. What the staff needs to do, like they have to use early intervention, strategies and engage in trauma-informed care, work with a multidisciplinary team, MDTS, understanding with morbidities. Depression often exists alongside anxiety, substances misuse, or uh, personality disorders. And the second one is practical implementation, organized practice. So in this we have they need to, the second one's practical implementation, organized practice, need for mental health training and general practice, emergency services and care homes, policy integration. Mental health should be integrated into all care planning, including safeguarding, capacity assessments, and care or act reviews. So uses of tools like PHQ, patient health questionnaire, and CPA like care programming approach. So thank you so much.
Depression is one of the most pressing mental health challenges of our time, and early is the key to prevent long-term suffering and loss of potential. We must begin where the young people spend most of their time: school, colleges, and primary care. First, we need to expand culturally competent services. It means varying staff so students and patients see people who understand their lived experiences. It also means investing in translation services to ensure language is never a barrier to support. When individuals feel understood, they are more likely to seek for help early. Second, we must invest in community-based models like peer support and social prescribing. Those approaches reduce isolations and build connections, critical tools in preventing and managing depression. When someone can talk to a peer, they be likely community resources. It can often stop off a downward spiral before it starts. Third, we must increase and the chest must improve. Right now, too many people are told they are not well enough to get help. Reducing limits, we shift from crisis response to prevention, catching depression early before it becomes life-threatening.
Hi everyone, I'm here with the conclusion and summary of what we've all talked about, the key issues, the critical analysis, the background, the introduction, as well as the recommendation. Here's the conclusion. Depression is a complex condition shaped by biological, psychological, and social factors. It presents challenges in diagnosis, treatment, and stigma. Health and social care professionals have a central role in creating accessible, equitable, and compassionate care environment. Thank you very much for your time.